Hi guys, it's me SandraTTC45, and I am on my way to physical therapy, and I think this is a perfect time to redo my little sunny out here. This is a perfect time to redo my my video regarding my health concerns. I had started a health concern video and I can't find it. I don't know if I deleted it by mistake or what I did with it. I got too many phones for one. I'm trying to, compact that and start getting rid of some of these phones. So I just figure I just start all over. But anyway, I have been wanting to talk to you guys about some things that I have been going through since the birth of the twins. Nothing to be seriously concerned about, so I want to make sure I've cleared that so you guys won't think that, I'm in a situation that, my life is at stake, and that is not the case. But so anyway, you guys already know, those of you who have been following me since I first started my TTC journey, that after I gave birth to Pebbles, I had my 1 year checkup delayed due to COVID, but was forced to go in because I was having some severe bleeding, and they later determined, after doing a pap smear as well as a scope of my uterine, that I had a placental site nodule. And at the time, the OB that I had then, his suggestion, of course, and probably because he was a male, was for me to, have a hysterectomy after my next birth. He knew at the time that I was attempting to get, have one more pregnancy so that I can give Pebbles a sibling more close to her age. So his suggestion was, if I didn't go into menopause, maybe it'd be in my best interest to go ahead and have a hysterectomy. Well, things didn't work out between he and I, so I ended up having to switch to a new OB, which was a female, and I let her know what he had suggested. She thought that was a little bit too extreme and not to really jump to that thought right away, which I'm glad she said that, because I was actually going to go forward, because he did have me a little bit afraid. Her suggestion was just to wait and see what happens. So during my 6 weeks checkup, the placental site nodule was still there, but there was no changes, which is what they was looking for, making sure there was no changes. So as a result, they wanted me to come back in 6 months to check again, make sure there was no changes. I came back in 6 months, there was still no changes. And when I came back in 6 months, at this time I was probably about 10 months postpartum. I want to say I was 10 months postpartum at the time. And I had just had a cycle maybe about 3 weeks prior to that appointment, and boy, was that cycle the worst. Oh my God, it was so horrible. It was really, really, really bad. So I was afraid when I went back that they was going to say that placental site nodule was getting worse because of how bad that cycle was. So at this time, I had a new OB, because my previous OB who delivered the twins, she had left and went into a different field. She still deals with, obstetricians and, baby delivery and stuff, but I don't know, something else, maybe in a higher field or something. So I had got a new OB. She did read the notes from the previous OB, so she knew what to expect and what to do as far as my health was concerned. So we did the scope again, and it was still no changes to my surprise. So I was like, well, why was I bleeding so bad? And so at that point, she wanted me to start monitoring the bleeding from that day forward. She said, you know, we're gonna probably have to reroute and start checking for other things if, you know, the bleeding continues. So she wanted me to come back in 6 more months for another one. So I go back in 6 more months, and everything seems to be, you know, cleared up for some strange reason. I didn't have the placental site module. It was there, but barely, you know, almost like it was just fading away. And I hadn't had no cycle since that last cycle that I had, which was the only cycle that I had after I gave birth to the twins. You know, I breastfed up until like 7 months, so I didn't get any I didn't get any cycle until like that 10th month or something like that. And I mean that 9th month, I'm sorry, I got a cycle that 9th month. So I didn't get a cycle the 8th month, which was the month after I stopped breastfeeding. But I did get a cycle 2 months later, which would have been the 9th month. And that was the month that, you know, the cycle was really heavy. But after that, I hadn't had any more cycles, so I was shocked when I came back to her and things looked clear, and then I hadn't had any cycles. So I was like, okay, well, where's my cycle at? I haven't seen that cycle since that one time. She's like, you ever had a cycle since then? I was like, no. So she ended up doing the testing on me to see if I was in menopause, you know, the FHS and all of that stuff you pretty much do when you're going through TTC, and they check your what do you call it, your estrogen and your progesterone and your FHS levels and all of that other stuff. Mine showed all normal. It didn't show any signs of menopause. So she wanted me to go and have a ultrasound done just to, you know, kind of look on the inside, make sure nothing was going on there. And they didn't find anything on the ultrasound besides a couple of fibroids, which those couple fibroids was there before I gave birth to the twins, so they hadn't changed. So she did some other testers on me, and basically I didn't find out until July of this year that the purpose of the tests that she was doing was to rule out cervical cancer. Now, cervical cancer usually don't have a sign of missed periods. It's usually a sign of real severe heavy periods, but that wasn't the case with me. But, you know, she had to rule out everything, so everything came back normal. So she suggested that we wait until, you know, a year have come, because technically they can't diagnose you with being in menopause until after you have been off your period for at least a year. And she did go back and take a look at the results again to make sure she didn't miss anything. And only thing she noticed was that, you know, the FHS level was on the high normal side, which means that I was probably going into menopause, so, but not exactly in menopause. So a year came, which was this year in September, I believe, and I still haven't had no period. So I haven't been back to see her. I don't go back to see her until February of next year. But I am just going to diagnose myself with saying I am in menopause, because I have not had but one cycle in over a year, and Lord knows I don't miss it and don't want it back. So, but the least of my worries are behind me, because it goes back to what the original OB told me, that, you know, if I go into menopause, then I don't have to worry about nothing. So I am excited about that. So that is one medical condition knocked off the books. So, and you guys already know that prior to me starting my TTC journey, I had already had a couple medical conditions. I had diabetes. I also had high blood pressure. Both of them was well controlled, which is the reason why I was given a green light to go ahead and do the TTC journey. And they're both still, you know, well, I can't say that the diabetes is well controlled. I don't know what it is about not being pregnant that I don't take my diabetes as you know, what is the word I'm looking for? Oh God, y'all know what I'm looking for. I don't take it as serious as I should be, like when I'm pregnant. When I'm pregnant, I'm very serious about taking my diabetes seriously, because I don't want anything to happen with the baby. And so I kind of did let that go out of control a little bit, and I'm trying to get back on track with that, which is one of the reasons why I told you guys after I gave birth to the twins that I was going to start a weight loss journey, and I was going to do the bariatric journey. Now, the bariatric journey, which will be a separate video from now, that has started and pretty much on its way to completion. It is a long journey. I didn't realize how long it was. I thought maybe 6 months at the most, but you know, talking to some of my co-workers who have gone through it, some of them it was a year. I also belong to a bariatric group on Facebook, and even they said, you know, some of them it took them a year. So it is a lengthy process, and the reason why it's a lengthy process is because these are the requirements of the insurance. So I pretty much did all the pre-preparations and requirements, or like they say in school, prerequisites. I've pretty much done all of that to move forward with the surgery. However, one of the conditions that I've been having has really come back to really bite me in the behind, so to speak. So I have been suffering from back pains for years, pretty much since I worked for the post office. Most of you know I delivered mail for close to 10 years, and when I got close to my 8th or 9th year, my body just started shutting down, which is one of the reasons why I got the heck up out of there. I was afraid that if I continued to work and do that type of work, which was too much, not to say that, it's not a good job. It's definitely a good job, good paying job. They work for every penny of what they get, if not more, but it's just not for everybody. I came into that job late in life, and what I mean by late in life, like in my 30s, versus a lot of those carriers came in there in their teens. They had been mail carriers since they graduated from high school. So that's different, because your body is still young, and then it get used to doing all of that. And then, not to mention, by the time you get to the age of your 30s or 40s, you don't have to do all of that physical type mail carrier work. You done been there long enough to do that easy mail carrier work. There's the physical type and there's the easy one. And so, me coming in at the age that I came in, with the physical type, and it was just a lot on my body. And so by the time I left there, my body was just over it, and especially my back. My back was, oh my God, I had so many back issues. I had ankle issues. I had shoulder issues, you name it, okay? So I had all of those issues being a mail carrier. And when I when I left the federal government and moved over to the state government, that was definitely enough physical position. I started feeling the changes in my body right away. I didn't have those aches and pains like I used to. I didn't have to go to pain management every 3 months like I was doing. I had to go to pain management. I don't know if it was every 3 months or every 4 months. I can't remember. But I had to get an epidural in my back. It was so bad. And so when I went over to the other job, I didn't even, I think I may have had 1 or 2 epidurals, and then I told my pain management doctor, I said, I don't think I need this no more. I don't have pain in my back like that. So I was happy. You know what I'm saying? The next time I started having really bad pains is when I was pregnant with Pebbles. When I was pregnant with Pebbles, the back pains, returned. But, when you're pregnant, you're going to get back pains, because it just depends on the position of the baby. My placenta was in the front, I believe, when I was pregnant with her. So she was more in the back. So that caused a lot of pain in my back, to a point where I was begging my OB for some type of help, some type of, whatever he can do. He first tried to send me to physical therapy, but physical therapy said there's really nothing they can do because of the fact that I was pregnant, that I was just going to have to wait until I gave birth and, see if I get relief then. And then he said, okay, well, let's try chiropractor. So we went to chiropractor. I first asked that chiropractor doctor when I first got there, are you trained to work on pregnant women? Oh, yeah, I'm specialized in pregnant women. No, he wasn't. Because that dude was treating me like I did not have a fetus in my belly. First of all, he wanted me to lay on my belly. Like, dude, no, I can't do that. And then we tried to lay on the side, and the way he was handling me, trying to adjust me and stuff. Dude, I got a fetus in my belly. What? No. I went back to my OB. I said, that's it. I'll just stick it in, And I did. I stuck it in until I gave birth. And after I gave birth, I felt the immediate release. Then came the twins. Now, the pain in the back when I had the twins was much worse than when I was pregnant with Pebbles. Man. And so that was to be expected because I was carrying 2 babies, And I don't remember having no back pain when I was pregnant with the twins the first time. But, as they kept reminding me, you wasn't 40-something years old, almost 50 years old. You talking 20-something years ago. Okay, I buy that. But this was pain like none other. Oh my God, it was kicking my butt. Oh my God. I literally wanted to work up until it was time for me to go in for my induction. But it was kicking my tail. And I finally decided, okay, 2 weeks prior to me going into induction, I'm about to stop. I can't do this another minute. And I told my OB, I was like, okay, I'm ready to take off. And she just looked at me and laughed and said, I'm surprised you waited this long. I said, I literally tried to go. I said, but my back is kicking my butt. I can't do it. I can't do it. And so she did try to offer to send me to chiropractor, but I told her that I tried that the first time. It didn't work. I said, I ain't even gonna bother. I'll just stick it out like I did the first time and wait until I give birth, because I know once I give birth, it's going to help relieve a lot of that pain. So I thought that was not the case at all. Stay tuned to be continued. Okay guys, I'm back. So, just when I thought that, giving birth was going to alleviate the back pain, it actually started getting worse. It never got better like after I had Pebbles. So I went to my primary care and I told her, something is wrong. My back pain never went away. In fact, it got worse. So she sent me to have an x-ray done. The x-ray showed that there was some arthritis and some possible nerve damage, which the x-ray can't pick up a lot, but just whatever they was able to see, she thought it was probably a good idea I go see a nerve doctor. Well, I didn't get into a nerve doctor until this year, because at the time I had the HMO, but I told you guys I finally switched from HMO to PPO. HMO served me well when I was going through the TTC journey because it pays for everything at 100%. But I was tired of the you know, having to get a referral to pretty much do anything or go anywhere. It was just a headache. So I finally went to PPO, and so I was able to finally get into a nerve doctor this year, outside of the hospital that I've been going to, because they only had, they didn't have a nerve doctor, that's what it was. So anyway, when I went to him, it was pretty much too late at that point, because prior to my appointment for the nerve doctor, I ended up making a visit to the emergency room, and this was right before my trip to Paris. And I was in so much pain. Not only was I in so much pain, but I had lost the feeling in my left leg as well as the feeling in my left foot. So the hospital did an MRI. No, yeah, they did an MRI. I was trying to think of was it an MRI and CT scan. They did an MRI, and the MRI did show that I had severe stenosis, which meant that my nerve in my back was being severely compressed. So they suggested was for me to go and see a surgeon, a neurosurgeon, instead of just a nerve doctor. So I went to see the neurosurgeon, but you know, at the time when he looked at my results, he didn't think it was as bad as it seemed. Let me put my glasses back on, because I don't know why I think I can see. He didn't think it was as bad as it seemed. So he wanted me to go back to pain management, and he also wanted me to do physical therapy, which, okay, fine, I'll do that. That wasn't helping. Instead, my back was getting worse and worse, and so he decided to repeat some of the tests that I had already had done, which was the MRI and the EMG. He didn't repeat the CT scan, but he did repeat the MRI and the EMG. And the MRI not only confirmed what the first MRI said, but it also stated that when comparing the two results, the second MRI shows that my stenosis had gotten a lot worse from the first time. EMG also agreed with the MRI that it was like severe stenosis in there, and that nerve was really, really pinched. So as a result, my only option is surgery. Now, I have not had the surgery yet. I'm actually a month out as of the date of this video. Not sure when I'm gonna upload the video, but as of the date of this video, I am a month out from my surgery. My surgery is scheduled for January the 4th. I will come back sometime in 2024 to give you guys an update on my health. I will also be giving you a video on my journey to weight loss using bariatric treatment, and you know, but the next video you guys will probably see will be an update on the kids. Okay, so don't forget to subscribe if you are enjoying my channel. Excuse me. Oh, I get choked up. I thank those who have started following me. I thank you for following me through all my endeavors here. I'm not on a TTC journey no more, even though my channel is still SandraTTC45, but because I started this channel as a TTC journey, I'm gonna keep it at that, because this is where you guys are gonna always know the update on me and the kids, unless anything changes and I decide to open up another another page. But at this time, it's gonna always stay SandraTTC45. Send a baby dust and love to all you ladies that's out there still in that war, because it is a war to be out there trying to conceive, especially in a day and time where things are so expensive now, and you know, insurance companies don't want to pay for nothing, and all of that other I vowed to myself, if I ever hit the lottery, the first thing that I'm going to do is donate to the cause of helping women have kids. Because I think that is very important, and it should be covered in all states for all women. Because we're the world. You know, we're the ones that creates the world. Without the women, there won't be nobody. You know? So, love and baby dust. Bye, ladies.